Hello, I'm Arthur Ollendorf, the DIO at Carillion Clinic, and welcome to our first podcast version of the GME core curriculum. We're doing this based on the feedback we've gotten from the residents and fellows. We're trying to find really easy to access resources to handle common things around leadership and conflict management and growth as we all go through this process of becoming physicians. With that being said, I want to introduce Sherry Wicker, who is a Senior Director of the Office of Continuing and Professional Development at Carillion, and is also an Assistant Dean in Faculty Development at VTC SOM. Thank you, Dr. Wicker, for leading this conversation today.
Welcome to the new GMECC podcast, Curriculum Corner. This is our first episode of the new podcast. We're very excited to offer this opportunity as a way to enhance GME trainee learning in the coming year. We have a great group of leaders from across our organization who will be sharing their knowledge and wisdom with you over the coming months. We look forward to having you tune in. Today, we'll be discussing conflict, how to manage it, and how to resolve it within our professional lives. Conflict is all around us. It's a part of our everyday lived experiences. While we don't usually go around looking for conflict, it will certainly find us. However, there are ways through which we can all manage and resolve conflict. Our guests for today are Dean Lee Lehrman and Dr. Lisa Urich. Dean Lee Lehrman is professor in obstetrics and gynecology and is our dean of Virginia Tech Carillion School of Medicine. Dr. Lisa Urich is associate professor for emergency medicine, director of well-being for emergency services at Carillion Clinic, and was recently appointed as the chief well-being officer at Virginia Tech Carillion School of Medicine. So welcome, Dean Lee Lehrman and Dr. Urich. It is wonderful to have you both be our first guests for launching of this new podcast.
And thank you, Dr. Sherry Wicker. It's a pleasure teaming up with you and Dr. Urich to discuss this important topic.
Yes, thank you so much. It's my pleasure to be here with both of you on our new GME podcast, TeachCast, and a big warm welcome to our listeners.
Wonderful. This podcast was developed to provide recognition, insight, and resources for conflict management and resolution. We recognize that conflict inevitably arises within our complex roles and systems. Today, we're here to provide you with some tools to tackle it. We want you as residents to feel confident and empowered with the knowledge and skills to approach conflict using appropriate strategies and resources. So by the end of today's conversation, participants should really be able to define some key concepts of conflict management and resolution, describe different strategies for conflict management, approach conflict management skills with confidence, and identify resources to develop conflict management skills. So really, before we can even begin talking about conflict management or resolution, we need to really define what conflict is and is not. So how do we know, hey, this is conflict? What are the indicators? What are your thoughts?
Well, I think maybe it'd be good for us to go back really to what the definition of conflict is. And I found the most meaningful definition for me to be a state of opposition of ideas or interests. So, of course, we can have internal conflict, but for today's discussion, I think our conflict will be assumed to involve two or more people. And then those people can have some type of opposing needs or drives, wishes, demands, or even opinions.
Excellent. That's a great place for us to start. So conflict is an inevitable aspect of any professional setting, especially within the high stakes environment of healthcare. So effective conflict management is crucial for maintaining a cohesive and efficient team, ultimately leading to better patient outcomes. We're going to use a case to anchor the rest of our conversation. The scenario we describe is likely one you've all encountered at some point. Our speakers will use this case to answer questions regarding a general approach for addressing the conflict, what would be some potential first steps, and what are other resources that are available. So you're taking call and receiving sign out from a co-resident who in the past has given incomplete information to you. This evening's sign out seems thorough and complete. During the night, a significant lab test result comes back that you were not told about at sign out. Although your delay in checking the result did not cause patient harm, it raised concern by the patient's nurse. After the shift, you contact the resident who signed out to you to request a conversation. Going back to our definition, how do we know this is conflict?
Well, for me, just having you read the scenario brings a gut feeling that alerts me that there is a potential conflict. And then that gut feeling is something to listen to. So in this scenario, there's maybe an anticipation of opposing ideas on what makes up unacceptable sign out. Or maybe there's an anticipation of opposing interests between a resident whose interest that day lies in getting home and another resident whose interest lies in providing high quality, thorough patient care.
Excellent. So there are some general strategies that are effective for managing conflict. So what works when managing a conflict like this? What are some steps you can take to manage conflict from a preventative standpoint?
A great question. Because this case relates to sign out, we get to the specifics of what we now know to be the most effective ways of having a complete sign out occur when shift changes and transitions occur. And that includes the use of structured communication tools that go through each patient systematically, either in the old-fashioned paper sign out list or on web-based tools, including those in electronic health records, which helps to really make sure every patient's pending labs are included in sign out. So some kind of structured communication tool would be appropriate. And the reason is that it's helpful is that the person coming on, the person leaving do have different sets of needs at that time. They may have different ways of prioritizing things, some raising more concern than others to each individual. So it's important to go with a structured tool that covers all the bases. The other way of preventing something like this is to look back to see what happened with this particular resident who is signing out, because an incomplete sign out was identified previously. And the question is, was any feedback provided at that time that would have helped that resident improve?
So is a structured communication approach even possible for a particular conflict or a conflict similar to this?
Well, in terms of the signing out process, those communication tools do exist and are commonly used. In terms of a script to follow in having a conflictual conversation, that can be more challenging because first we have to think about the underpinnings of conflict, the differences in what we see, the differences in how we think about what we see and the conclusions we make, and the differences in our emotional state and our emotional needs at the time. So it's hard to script how to respond to a particular conflict. First, you have to get curious and figure out why.
And there are times at which a lot of times even hearing the word or saying the word conflict it can be a little stressful. So how can managing conflict impact your own well-being or well-being in general?
Yeah, that's a great question. And there's lots of different ways that conflict can impact well-being. Um, Anticipating a conflict can cause anxiety, especially for people who are prone to want to avoid conflict or to really feel safety with harmony or peace. And the anticipation of a conflict can take up a lot of your mental energy that really could be better used for other creative or more fulfilling endeavors. A mentor of mine lives by the saying, eat your problems for breakfast. And I love this. Basically, do your best to decrease the time between when you realize that you have something challenging to do and actually doing it. And there can be suffering in that anticipation. And if you limit that, that can really help your well being, or at least minimize the negative impact that a conflict can have on your well being. And then also conflict impacts well-being because it brings up other feelings that we don't always like to feel, and that can be anger, frustration, and isolation. And then some people um, when you're in conflict, you no longer feel a sense of safety or security, all of which obviously will affect how well you feel.
So, are there communication skills that work really well in mitigating and managing conflict?
Yeah, I think so. Approaching the conversation with curiosity as opposed to defensiveness really goes a long way. And that can be hard to do, especially if you didn't know the conflict was coming. If you're the person who's approaching a conversation that might have conflict and you have time to prepare, you may be able to do the mental preparation to get there, but you don't always get a warning that a conflict is happening. So, approaching a conflict with curiosity, it requires a self-awareness and a lot of intentionality. So first, seek to understand the other person, and then after you understand their point, then seek to be understood. And this usually helps to facilitate a resolution. Do you mind? Do we have time for a short little story here?
Absolutely, please.
Okay, great. So people may have heard this. I think it's a great illustration, but there were two children who were fighting over an orange, and their father was very tired of the conflict and the sibling rivalry, and he cuts the orange in half and gives each half to a child. And the daughter's disappointed because she needed the zest of the whole orange to make her orange cake. And then the son is irritated because he wanted to make fresh squeezed orange juice and half of the orange didn't make enough. And obviously, the point here is that if the father would have let the children understand each other's needs, left room for curiosity, then we could have found a better resolution than each of them getting half of what they needed. So I think that just story to me helps illustrate and point out why we should seek to understand first before we try to move towards a resolution.
I love that little story. How perfect. What a perfect approach to understanding this. So, so there are some helpful approaches, and are there some approaches that can be harmful when working to mitigate conflict, or are there some things that we know that just don't work?
Yeah, I'd build on Dr. Urich's comment around self-insight. In the case of a conflict, it often triggers emotions that are very primal because the first conflicts we experience are early in life with our family members. They're very dramatic. And so some people will go from a sense of calm into a sense of storm when they are in a conflict. And that's really not a good place to have a productive conversation. So it's really important to check yourself and take a few deep breaths, check your pulse, take a and develop a strategy on how to approach the conflict. Because if you're avoiding it because it's uncomfortable to talk about, that's not a great solution. If you express anger, disappointment, threatening language, or nonverbal communication, those don't work either in the long term for helping the other gain insight. And it's more about how you feel rather than seeking to understand what happened with the other person. So instead, on the other side of the coin, what can we do that's productive? Is we can make sure we have a private conversation when both of the residents involved are rested and have no urgent personal or patient care issues pending, to create a sense of calm for the two of them to have the conversation. They can create psychological safety for each other by helping the other person feel valued and important, because this one thing that happened does not define their value or the sense of the relationship they have together. To put that in context is helpful. And also not to use labels when describing the behaviors that you encountered that were so troubling to you. So instead of saying, you made me look like an idiot to the nurses, it might be better to say something like, you didn't mention that patient X had a creatinine pending. And when I didn't check it, the nurses really expressed concern, and that made me feel that they thought I was irresponsible. So that doing that more descriptive language is better than the labels and the emotional language.
Wonderful. Thank you so much.
Yeah, if I could just add on to that a little bit, I think Dean Learman, those are really good reminders. Um, you know, conflict is inevitable and can really be, it can be difficult. It can even be draining. But there's also an opportunity in conflict, and remembering that through differences of opinion or different agendas, you can really seek understanding and growth. And it's an opportunity to handle the conflict well and then strengthen relationships. And even within teams, doing conflict well, being both heard and understood, and then working together for conflict resolution can build trust and improve your whole culture, so that when things like this come up in the past, people aren't afraid to give a different opinion that may shake things up a little and may actually in the long run cause improvements and change for the better.
If I could just build on that great comment, Dr. Yerk, if you've ever met a couple that's been together and they're contemplating getting married, and then they tell you, we've never had a conflict. I don't know about you, I start to worry about that a little bit, because conflict is a healthy way to kind of build a deeper understanding of each other in a relationship and how you manage through those differences of approach. So it is such a normal thing and such a productive thing when handled correctly the way you described.
Yep, love that. I couldn't agree more. I assume after this podcast, after listening to this, we'll have a lot of great approaches in our pockets, things to do, things not to do. But I also assume that there have to be a lot of additional resources out there to help us to manage conflict even more effectively. So, uh, where have you looked to find resources to support your efforts to manage conflict?
Yeah, some of these are really good tools that you can use with yourself around how you approach the puzzle of a conflict and how you arrange a strategy for managing it. So first, ask yourself, what am I seeing or hearing, and what am I not seeing or hearing? If there are two people involved in a conflict, there's probably at least three perspectives on what happened. So how do we gain a broader perspective on what we're seeing and hearing, other than the narrow slice that we might have to start with? Next, the next kind of habit on managing conflict is to realize that your brain is hardwired to form conclusions, and sometimes hasty conclusions based upon limited information. So am I jumping to conclusions based upon previous experiences with this person, or biases or stereotypes I might have about them or people who look or sound like them? What other explanations could there be instead of the ones I'm jumping to in terms of those inferences that I'm making? It can help to find a colleague or mentor who can chat with you when you encounter a conflict and challenge your thinking in certain ways that allow you to be more rigorous as you put together the question of what is going on here. So using your tools, you figure that out and understand these different perspectives on the situation. And then you practice what you'll say and how, when, and where you'll say it to have a constructive conversation free of fear. And this is the skill building. Skills require practice and feedback. And so it's great to find a buddy who can help you through that as you start to take on conflicts. And they'll get more and more complicated probably as you emerge into your careers.
Very helpful. I think all of these are excellent suggestions. And I think sometimes it can be so frustrating and even intimidating to approach a colleague. But if it's close, trusted colleague that you can, get an unbiased opinion from, I think that can always be helpful and have a discussion and practice. Wonderful suggestions.
I'd
So,
also like to make a brief plug for a kind of a self-awareness tool. There are actually 5 different conflict management styles, and they each predispose us to respond in certain ways when we're in a conflictual relationship. And rather than taking you through all 5, I would just recommend that our listeners go to stylematters.com, and there's a web-based assessment of your conflict management style that you can do on the website. I take no kickbacks from stylematters.com. And that includes an assessment of what you do when you're feeling calm and what you do when you're feeling more stormy about the situation. And there's an elaborate summary of where you score on all the different styles and what it means for your approach to conflict. And I believe that the price is about $10 for that in a web-based version of this. So I would very much encourage people to gain the insights into themselves to understand how they're predisposed to manage a conflict. Each style is a great fit for certain situations. So if you have to rush a patient, through a bunch of obstructions of care into the operating room or wherever it is, if you're trying to take care of a patient in an emergency, then that competitive conflict style is what you must do sometimes. But it doesn't work a lot of the other times. So just becoming aware of what style are you prone to use and what style fits the situation is a very helpful tool.
excellent. So that's something we can all go and do right after this podcast just to be prepared for the next time that conflict arises. So, if there was anything that you wanted folks to take away from this conversation, what would you say that was?
Well, I'd start with words of encouragement because it's not easy, but understanding and managing conflict are critically important skills for all physicians, whether you're leading a patient care team or become a clerkship director or residency director, department leader, medical school dean, science, team science leader. Any of those situations are bound to create a setting for potential conflict. Leaders, they first seek to understand why interests appear to be incompatible in a conflict. They make it a part of the rigors of thought to identify it and start to process it as an opportunity to figure out something deep and important. I mentioned that practicing skills can be very helpful as well. And there are also leadership development programs that may occur in your specialties, in residency programs and for faculty in different specialties that have explicit conflict management skill building as a part of those programs.
So, any last words of wisdom from either of you?
Yeah, thank you. I think I'm feeling like it's important for me to say that I'm on my own journey of how well I handle conflict. I would not say that this was a skill that I was particularly good at early in my leadership career. And if I'm talking about this at all today, like I have it all figured out, that would not be honest. So, but it's a work in progress, and I'm committed to the growth of becoming better and better at conflict the longer I am into my professional life. So that's encouragement that if you don't feel like you're good at it, you're not good at it yet. You're not good at it. So I'll just summarize really quickly some things that really work for me. Um, I like to remind myself that I'm here for the long game, and this is both personally and professionally. So, true conflicts are absolutely critical and worth solving, but not every problem needs to be approached as a battle. And, small things that aren't worth, um, creating a conflict about, are not worth creating a conflict about. This is really about the long game. And then also, when there is a conflict on the horizon, I eat my problems for breakfast so I can move on to other more important work. I'm busy. I got a lot of really great creative things I want to do, but I can't get there if my mind is perseverating about something challenging in my near future. And then just lastly, to reiterate that when I'm entering a conversation that involves an opposition, I really want to seek to understand first. And then after that, I'll get my chance to be understood.
Great. That's great. I guess the only thing I'd mention is something a little bit new, and that has to do with the relationship between managing conflict and diversity, because I think it's important to spell that out. Managing conflict is absolutely essential for unlocking the expertise of people with diverse life experiences and perspectives. It's essential for achieving excellence through leveraging all of that talent when it comes to patient care, medical education, team science, administration, whatever you might be leading. And I'm just so grateful that you decided to focus a podcast on this important topic.
So thank you, Dean Lehrman and Dr. Urich, for being with us today and sharing your wisdom and expertise with us. Conflict is a part of living, but like we've learned today, it isn't something that we have to let control us. We can manage and resolve conflict in ways that are productive, that create learning opportunities, enhance well-being, and we can take steps in the management of conflict to make strides to prevent future conflicts. So thank you all for listening. Thank you for being here. We hope you feel more empowered now to better approach conflict, and don't be afraid to start using these skills today. Thank you all. Enjoy the rest of your day.
Thank you. What a
Thanks
pleasure.
so much.
So there may be times when you approach somebody and the conflict is not resolved. If that does happen, some of the resources you have at your disposal are the attending physician you're working with, your program director, or your program manager. If for some reason you feel more comfortable going outside of your program leadership, the Graduate Medical Education Office, including myself, are always an available resource.